Well, frankly, I'm a doctor. I've been taking care of patients for the last 30 years, and I think that this healthcare plan is simply taking medicine in the wrong direction. The president's healthcare bill doesn't solve any of our problems. It's making healthcare more expensive. The problem with healthcare in America is it's too expensive, and the president's plan hasn't decreased costs at all. I mean, last year the healthcare premiums were up 9%. In the last 2.5 years, they're up 19%, and it's going to make a real problem for American consumers and small businesses in northern Michigan. Frankly, I've been doing my 100 businesses in 100 days tour, and a lot of people throughout northern Michigan are telling me, "Hey, this is going to cost me too much money. I mean, I'm not sure if I can continue to provide health care for my employees." It may be the difference between staying open and providing health care, and I have to stay open. And they're concerned about that cost and their ability to hire more people, because I want policies that will create more jobs in northern Michigan. We have a high unemployment. Everybody's worried about their job, and I want people to be able to hire more people. And with this increasing costs like this, it's not making it easier for people to hire. It's making it more difficult. Well, I think we need to repeal it. There's too many bad parts to the bill that we can to eliminate them one at a time. I mean, there are some things that we need to change in healthcare. There's no doubt about it. Number one, the cost. Number two, there's been some things that the healthcare bill brought forth that people agree with. For example, being able to keep your children on your health care until you're 26. Well, I'm all for that. But insurance companies are working on getting that done without a mandate from the government. People are talking about, of course, being able to get insurance if you have a pre-existing disease. Of course, we need to have people be able to get insurance with that. But we don't need a complete takeover of our healthcare system in order to get that to happen. And we need to decrease costs. I always compare health insurance to car insurance. And with health insurance, there's only 3 or 4 companies in the state of Michigan you can buy health insurance from. You can buy your car insurance from thousands of companies across the country. And that's what we need to get going in this country, is having more competition so that costs come down, and people should be able to buy health insurance from wherever they want. Well, I think that the highlight of my term in office actually has been being able to serve on the Veteran Affairs Committee. I worked at the VA as a doctor for the last 20 years as a consultant, and I have a real affinity for the veterans, and my daughter's a veteran. And we've done some good things at the VA. The problem with that bureaucracy is that it takes a long time for veterans to get their benefits. The average claim time to get a disability benefit is like 18 months. That's far too long. But I've been able to find out a lot about how that system works. We've been able to put some bills through to improve that process. It's a slow process. I'm proud of the fact that in our district offices we've been able to help on an individual basis multiple veterans who have been working for to get their benefits, and that's been a real source of pride that my office has been able to get that done. And I encourage people, if they have an issue with veterans benefits, to call our offices, because we have a good team of people working on claims and expediting those claims. So I really want people to know that we're available to do that. I've been able to have several roundtables with veterans and veteran service officers across the district to hear from them the things that we could do to improve veteran services. And actually, we got a piece of legislation that we're working on now that may help to improve the process quite a bit. So I'm really proud of the work I'm doing in the Veterans Committee. And my value, frankly, is the fact that I'm not a politician, and I've been taking care of patients as a physician for the last 30 years. I mean, I got in this race in 2010 because I was concerned about our children and grandchildren, what's going to happen to them with the amount of spending that the government's doing. And, frankly, my opponent and the Democrats in Washington, they're spending more money than we have. For every dollar the government spends, they're borrowing 42 cents. And we're putting that charge directly on our children and grandchildren. This is the first time in the history of America that one generation is saddling the next generation with trillions of dollars in debt. And I believe we need to put that a stop to that so that our children have the chance to get the American dream. I grew up in Iron River, and we were poor growing up. I was able to get a good education, and frankly go to medical school so I can get a job in the UP. And I want my children and grandchildren to be able to do that. You know, be able to find education and find a job here in northern Michigan to live and be prosperous here. Well, I don't know. I mean, I was elected with Tea Party support because they agree with a lot of the things that I believe in. And I believe a lot of things that they believe in. And I don't believe that the government should be spending money we don't have and saddling our children with debt. I mean, that's what the majority of the people in the Tea Party believe. You know, they want to see a government that doesn't put our children in trillions of dollars in debt and mortgage their future.